Hi, this is Dr. Victor Dominguez. I just wanted to show you guys an important functionality within Allscripts. It's important that you guys realize that anytime you document anything within the free text plan, that will show up in both the clinical summary and it will show up in the portal. So if I document here, that will show up in the portal in the clinical summary. When you document within the discussion summary, free text area, this will not show up in the clinical summary nor in the portal. It will show up in the note, but it will not show up in the other two. So if there's anything that you want to include as part of your note documentation that you don't want to show up in the clinical summary or portal, then please document within the discussion summary free text area and not in the free text plan area. Okay, that's number one. Number two, for medications, anytime you order DC a medication, that will also show up in the clinical summary and in the portal. If you use record DC, then that medication will not show up in the portal or in the clinical summary. So sometimes when I have a whole bunch of antibiotics that have expired, or vitamins or ibuprofen, and I don't want those medications to clutter the clinical summary, then what I do is I choose record DC to avoid those medications or vitamins showing up in my clinical summary or in the portal. But if it's a pertinent medication like a blood pressure medication or diabetic pill, at that point I would recommend you use the order DC. That way that will show up in the clinical summary for the patient to see.